This is Amanda Jelinek, and this is my head-to-toe assessment. Starting off by scanning the room. All right. All right. First, I would go ahead and check my patient's chart. Once I enter the room, I would make sure to provide privacy and perform hand hygiene. Then I would introduce myself. Hello, Mr. Perez. My name is Amanda. I'll be your nurse today. And can you go ahead and tell me your full name and date of birth?
It's Marco Perez, 7988.
All right, thank you. And what brings you in today?
Just to check up.
All right, and are you in any pain?
No.
No, okay. So I'm going to start by looking at my patient overall from what I see for his skin and hair. And looking at him, I don't see any lesions or scars. He does have tattoos on his upper arms or upper extremities and his right side of his neck. His color is true to ethnicity. He doesn't look jaundice or any signs of cyanosis or pallor. I'm going to go ahead and feel your temperature. And he is warm to touch, and his skin is dry. Do you have any skin problems, any ear rashes or anything like that?
No.
No. Have you had any excessive hair growth or loss?
No.
And his hair, from what I see so far, is evenly distributed. It is true to ethnicity for his color and for the texture. Now I'm going to go ahead and test your skin turgor. And it pulled right back, showing that he is well hydrated. All right, and now I'm going to go ahead and go on to your head. Have you had any head trauma or injuries in the past?
No.
No, any dizziness or headaches at all?
No.
Okay. Any type of mental problems and your mental issues for you or your family?
No.
Looking at his head, it is normocephalic. His facial features are symmetrical. I don't see any masses or bulging anywhere or any scars on his face. I'm going to go ahead and palpate your head, okay? Tell me if you have any tenderness. And I don't feel any bulges or masses on his head. Was any of that tender?
No.
No, okay. Now I'm going to go ahead and move on to your neck. Can you lift your head up? Looking at his neck, I don't see any bulging or masses on him. It's not. Doesn't look like there's a deviation in his trachea at all. Do you have any thyroid issues?
No.
For your family either?
No.
Okay. If he did have thyroid issues, or if I seen any type of masses or goiters, I could check his thyroid by coming from behind and moving his trachea, or moving his trachea to the side, going under to feel the thyroid. I'm going to go ahead and touch your face a little bit, do a couple things. I'm going to have you open your mouth and close it. Go ahead again. And I was testing his TMJ. I didn't see any, I didn't feel any clicking, which is good. And now I'm going to have you close your eyes real quick and tell me if you feel a sharp or dull feeling and where you feel it. Where at?
On my cheek.
What side?
Right. That one felt a little sharp.
And where at?
On my left cheek.
All right.
That one felt kind of dull.
And where at?
On my forehead.
All right. So I would say that his cranial nerve number 5 is intact. I'm going to now have you puff your cheeks out, raise your eyebrows, smile. You don't have to puff your cheeks anywhere, and frown. Frown. Okay. So his cranial nerve number 7 is intact as well. Now I'm going to go ahead and feel your maxillary glands as well as, or sinuses, sorry, maxillary sinuses and frontal sinuses. Did you feel any pain there?
No.
So we're going to go ahead and start with your eyes, I guess. Do you have any problems with your vision?
No.
No? Have you gone and got eye exams regularly throughout your life?
Kind of, yeah.
Okay. Have you noticed any blurred vision at all?
No.
No. Looking at his eyes, the outer canthus of his eye does line up to the top of his ear. His eyes are symmetrical. The hair on his eyebrows and his eyelashes are evenly distributed. Can you go ahead and pull your eyelids down for me? Alright. And his conjunctiva is pink and moist. And can you pull them up a little bit? His sclera is nice and white. No signs of opacities. I'm going to go ahead and look at your pupil size. His pupils are about a 4 bilaterally, and they are round. And now I'm going to go ahead and shine the light in it, coming from the side. All right, and now I'm going to go out to the other side. All right, and his pupils did constrict with direct light and consensually. All right, and now I'm going to do accommodation. I'm going to have you look straight across the room, and then once I put my pen in, change your focus to my pen. All right, so shows that he has accommodation. Now I'm going to go ahead and move on to your nose. Have you had any problems with your smelling?
No.
No. If he did have problems smelling, I could test his smelling by putting coffee or garlic in front of him and have him guess what the smell was. Can you go ahead and put your nose or your finger on your nose and breathe in? And on the other side. And all right, both nares are patent. I'm going to go ahead and look in. It is moist and pink in his nose. No signs of drainage. No foreign objects. I didn't see any deviation in his septum or perforation in his septum. And his turbinates were moist and pink as well. Now I'm going to go on and move down to your mouth. Looking at his lips, they are nice and pink. No signs of any cracks or scars. Have you had any problems with your taste at all? No. Any problems with your teeth?
No.
Do you get swollen sore throats often?
No.
No. Can you pull your upper lip down like this? All right, and up top. All right. His gums are moist and pink. His teeth are intact. And go ahead and open wide. All right. His tongue is moist and pink as well as his buccal mucosa. I don't see any spots in his throat or anything like that. Any white spots. Open your mouth one more time and say ah. And his uvula and soft palate his uvula rose above midline, and his tongue did not deviate to a side at all. So that shows his cranial nerves 9 and 10 are intact. While I'm on your mouth, can you go ahead and stick your tongue out and side to side like this? All right, and can you say light, tight, dynamite?
Light, tight, dynamite.
All right, and that shows that cranial nerve number 12, is intact. I did forget to mention when I asked him about his sight that the cranial nerve number 2 will be intact, and with him not having any smell problems, cranial nerve number 1 was intact. Now before I move on, I'm going to ask, I forgot to do one thing with his eyes, so I'm going to do that now. I'm going to have you follow my pen. Don't move your head, just follow with your eyes. Alright, and that shows that his cranial nerves number 3, 4, and 6 are intact. Now I'm going to go ahead and move on to his ears. I already said that his top of his ear was lined up with the canthus of his eye. Now I'm going to go ahead and push, tell me if there's any pain. Push on your pinna, pull on your, push on your tragus, pull on your pinna, and push on the mastoid process. Was there any pain in that?
No.
I'm going to do the other side too real quick. And have you had any loss of hearing at all?
No.
No. Have you felt off balance at all?
No.
Okay. I'm going to look in your ear. His ear is nice and pink inside. There's no sign of any drainage or extra rumen. No foreign objects. Look in this side as well. And again, it is pink inside, no redness, no excessive drainage or rumen, and no foreign objects. All right, now I'm going to go ahead and I'm going to ask you a couple neurological questions. Do you know where you're at today?
Yeah.
Where at?
Oh.
Okay. And do you know who the president is?
Donald Trump.
All right. So I would say that my patient is alert and oriented ×4. He earlier stated his name and date of birth. He knows where he's at and the time. Also, his mood is appropriate for the situation. His hygiene he's well groomed, and I would say he's appropriate for the situation. I did make him wear this for the exam, so he would have had more on if not. His facial expression is calm. His word choice is appropriate, and he is clear and understandable. I would say his thought process is understandable and logical as well so far. And I will be assessing his neurological portion of his exam throughout the exam as I go on. If any of that changes, I will go ahead and make note. But I would say his behavior is appropriate for the situation. Alright, so now we're going to go on. I'm going to have you take your shirt off. And have you had any problems breathing recently?
No.
No, any coughs?
No.
Looking at my patient, I don't see any scars. I'll move the camera down just a little bit. I don't see any scars on his chest or any masses anywhere. His skin color is still true to ethnicity, and he is still warm and dry. I'm going to go ahead and look at his lung field, starting at from his apex up here down to about the 5th rib. Looking over at the 5th intercostal space and the clavicular, I do not see any heaves or lifts at all. Looking at his face, he does not look like he's in respiratory distress. He's not using any accessory muscles. Now I'm going to go ahead and palpate his chest. Any tenderness?
No.
And again, no masses found. Now I'm going to start by percussing his lung field, starting at the apex above the clavicle. I'm going to use the Naja Louie and move over to the second intercostal space and go down. And do the same thing on the other side. I'm going to move to the other side. Using that Naja Louie to find my second intercostal space. Alright, and my sound was resonant, which is a normal finding. Now I'm going to go ahead and auscultate using the diaphragm of my stethoscope, the same lung fields that I just percussed. Go ahead and take a deep breath each time I touch it. I'm going to go to the other side. Alright. I'm going to note that there were no signs of any wheezing or crackles, no adventitious sounds, and his lung fields were clear on all levels. I'm also going to go ahead and listen to the heart sounds while I'm here, and I'm going to use the bell side of my stethoscope for that. Alright. I'm going to do 8 to man. I'm going to start off using the Naja Louie, to find my second intercostal space, right sternal border. That's going to be my aortic sound. Then if I go to the left sternal border, still second intercostal, that's going to be pulmonic. Go down to the third intercostal space, left sternal border, that's going to be my Erb's point. Go down to the fifth intercostal space, left sternal border, that's going to be my tricuspid. And then I'm going to say fifth intercostal space, left sternal border, but I'm going to move over to the mid-clavicular line for the mitral valve. I'm going to listen now. And I did hear S1 and S2. It was normal. There were not any extra sounds or any adventitious sounds, no murmurs or anything like that. While I'm looking at your heart or checking your heart, have you had any problems with heart disease in your family at all?
No.
No, okay. It is, do you know, like the signs of a heart attack? Chest pain?
Yeah.
Okay. So it is important for you to make sure you pay attention to any heart problems that you have, because being an African American male, your risk for heart attack and heart problems is higher than normal. Now I'm also going to check your carotid artery while I'm over here. And I would say that's about a 2+. I'll go back to this side. And I would say that's a 2+ as well. And now I'm going to auscultate for any bruise, still using the bell side of my stethoscope. And for this one, I'm going to go ahead and have you take a deep breath. Exhale it. As you exhale, hold the exhale until I tell you to take another breath. Okay, go ahead and take a deep breath. And exhale and hold it. Go ahead and take a breath. And exhale and hold it again. Okay. Go ahead and take a deep breath. And exhale and hold it. Okay. And go ahead and take a deep breath. And exhale and hold it. Alright. And I did not hear any signs of any bruise, no swishing sounds or noises, adventitious noises. Before I move on to the back side, I also want to check the temporal artery. And that is about a 2+ bilaterally. Okay, so now I'm going to go ahead and have you turn so I can see the back of your, face the back of the camera. Your back to the camera. Alright. Okay. Alright, so looking at my patient's back, his skin is warm to touch and dry. His skin color is true to ethnicity. I don't see any scars or macules or any lesions on his back. I'm going to go ahead and palpate. Let me know if you have any tenderness, no masses or bulging, and I don't feel any crackling or any signs of crepitus. Was there any pain when I touched? Okay. Now I'm going to go ahead and do tactile fremitus. So I'm going to have you say 99 every time my hands touch.
99. 99. 99.
All right. And the sounds, the vibrations did diminish. Excuse me. As I went down, which is a normal finding. I'm also going to check the AP diameter. Excuse me. Which is about a 1 to 2, which is also a normal finding. Now I'm going to, sorry, just get the camera right. Now I'm going to go ahead and percuss the lung fields. I'm going to start at C7 and go down to T10. And I'm going to use, before I percuss, I'm going to use the scapula as T7 to move down to T10 and check for symmetrical expansion. Can you go ahead and take a deep breath? And let it out. Alright, and his symmetrical expansion was symmetrical, and it was equal. Now I'm going to go ahead and start percussing, starting at the apices and moving down. and his sounds were resonant, which is normal finding. Now I'm going to go ahead and auscultate using the diaphragm. And go ahead and take a deep breath each time I touch. And his lung fields were clear on all levels bilaterally. No signs of any wheezing, no adventitious sounds. Now I'm going to go ahead and have you turn around. Alright, so now I'm going to ask you a few questions about your diet. Have you noticed a change in your appetite at all?
No.
No. Have you noticed any weight loss or gain?
No.
No. Any pain in your abdomen at all?
No.
No. Any problems urinating?
No.
No. No burning or frequency?
No.
No. Do you know when your last bowel movement was? Can you tell me what it looked like?
Round, soft.
Okay. And do you have like a regular, you think you are regular when it comes to your bowel movement? Okay. No signs of any blood in your urine or your stool at all?
No.
Okay. Are you sexually active?
Yeah.
And do you use protection?
Yeah.
All right. And I'm going to, 1 second, I'm going to blow my nose and perform hand hygiene again. Perform hand hygiene. Apologize, Mr. Price. Now that we know that you don't have any problems going on in your stomach, I'm going to go ahead and do an examination on it. I'm going to have you lay down, but before I do, I'm also noting that I checked for jugular distension. I do not see any, but I'm going to go ahead and have him lay down. This camera a little bit. And looking at his neck, again, no jugular distension. If you could sit up just slightly on a 45-degree angle. And again, still none. If I did see it while he was laying down, I would have him do that to verify if it is. Now, alright. So, I don't see any lifts at all, any pulsations in his abdomen. His umbilical is midline. And his abdomen is symmetrical. I'm going to start before I do that. I'm going to listen to the renal and aortic arteries for bruits using the bell side. aortic, and the renal, and then I'm going to do the iliac, I do not hear any bruise. Now I'm going to go ahead, feeling skin. You are warm to touch still and dry. I'm going to go ahead and percuss now, or no, sorry. I'm going to go ahead and auscultate for vowel sounds using the diaphragm, starting in the right lower quadrant. Moving to the right upper quadrant. Moving to the left upper quadrant. Down to the left lower quadrant. And his vowel sounds were normal. I wouldn't say they were hyperactive or hypoactive. If I didn't hear any vowel sounds, I would have to sit here and listen for a total of 5 minutes to make sure. Now I'm going to go ahead and percuss in the same order that I just auscultated. Starting in the right lower quadrant, moving up to the right upper quadrant, left upper quadrant, and left lower quadrant. And the sound was tympanic, which is a normal finding. There was a slight dullness in the right upper quadrant, but that was over his liver. Now I'm going to start with light palpation in the right lower quadrant, and if you have any pain, please tell me. Moving up to the right upper quadrant, no masses noted. In the left upper quadrant, and to the right, or left, sorry, lower quadrant. And I didn't feel any masses or any bulging. I could also do deep palpation, but for the sake of my patient, I'm not going to today. Now I'm going to have you sit up, and I'm going to test your extremities. Alright, you go ahead and put your arms out like that. Alright, so his arms are symmetrical. They are nice and warm and dry to touch. Oops. This up a little bit. He does have tattoos throughout his upper extremities. Can you go ahead and push on against my hands? Alright, and pull my fingers, grasp my fingers. Alright, and pull me towards you. Alright, and his strength is normal. I'm going to go ahead and feel on your joints. Do you have any joint pain at all? No. And I don't feel any edema. While I'm here, I'm going to check his brachial artery. And I'm going to go on to the other side. And they are a 2+ bilaterally. I'm going to move on to the radial. Right. And up to this side. And they are a 2+ bilateral as well. His His hair is evenly distributed. Skin color is true to ethnicity still. I would say, can you go ahead and move your arm like this? Alright, and can you move it out, away from your body, and in, towards your body? And can you do this one as well? And move it out and in. Okay. Any limitation in your movements at all for your upper extremity?
No.
No, okay. Now I'm going to have you hold your hands out and I'm going to check your cap refill. Like this. Facing the camera. Alright, and your other arm. Alright, and his cap refill is less than 3 seconds, which is normal. I'm going to move the camera down so you can see his lower extremities while I test those. Alright. Okay. So looking at his lower extremities, they do look equal bilaterally, or symmetrical bilaterally. The hair is evenly distributed, still warm and dry to touch. Any pain in your joints down here? No? Okay. I'm going to feel for edema. No signs of edema, no swelling on the joints. I'm going to have you lift your legs against my, okay, and push your feet against my hands, and the other way. Alright. And I'm going to have check your refill on your toes. Go ahead and bend them. Alright, and another one. Alright, and they all were less than 3 seconds. While I'm down here, I'm also going to check his sensation on his feet. So close your eyes, sir, and tell me if you feel dull or sharp.
Do it again. Sharp.
Alright, and which foot?
Right. Duh.
Which foot?
Left.
Alright. And I'm going to go ahead and move up now. Now I'm going to have you do a little moving. Can you stand up? Can you go ahead and walk from here to that wall and back? And my patient's gait is steady. He did not have any swaying. I'm going to have you stand like this, close your eyes, and one finger to your nose, and the other. And that is normal. Go ahead and put your hands down. Keep your eyes closed and just stand straight. And this is his Romberg's test, which is normal. I'm also going to do the whisper test with it while you're standing up. Go ahead and repeat what I say.
Hot dog. Burger.
Alright. So that would show his cranial nerve number 8 is intact with the Romberg's test and the hearing test. Now that you're standing, you can open your eyes. Can you shin to heel? Or, yes, heel to down each shin. And the other one. Alright. And you can sit back down. Now I also need to check your foot for the Babinski reflex. And that is a normal Babinski reflex. I'm going to do the other side as well. Alright. Alright. I'm sorry, Mr. Press. I did forget to have you do a little bit of range of motion with your legs. Can you stand up one more time? And can you go ahead and do the same? Move your leg in and out. Moving the camera so you can see better. Other one. And can you point your foot in? Doing inversion towards you. Put your foot in like that towards your body.
What are you talking about?
Like this.
Let's say turn it.
And then out the other way. So he can do inversion and eversion. And moving his extremities in is adduction and away was abduction. Alright, go ahead and sit down. I'm going to continue with my extremities and do my the rest of my pulses. So I'm going to move these up and check his popliteal arteries. Just behind. It can be difficult to find sometimes. And onto this side. And I would say those are about a 1+ bilaterally. I am going to move down to tibial, posterior tibial, and on this side. And they are about a 2+ bilaterally. Go ahead to the dorsalis pedis, the top of the foot. And on this side, and they are about a 2+ bilaterally as well. Before I conclude my assessment, I am going to go over my cranial nerves just to make sure I got them all. Cranial nerve number 1 was his smell, number 2 was his sight, 3, 4, and 6 were his cardinal gazes, 5 was his facial sensation and TMJ. 7 was his facial symmetry with the puffing the cheeks and smiling and frowning. 8 was the hearing and Romberg's test. 9 and 10 were the no gag, soft palate, and uvula rise. And 11, which I did forget, is for your neck. Can you push against my hand? And on the other side. And raise your shoulders. Alright, so cranial nerve number 11 is intact, and cranial nerve 12 was intact when we did like tight dynamite. One more thing that we need to do are the lymph nodes. So I'm going to go ahead and feel for your lymph nodes with your preauricular. I'm going to move this camera a little bit closer. The preauricular in front of your ears here, going behind them for the postauricular, and in the back of the neck, back of the head, for the occipital. Lift your head up. I'm going to feel under here for the tonsillar, going up the chin, or up the jaw for the submandibular, and right under the chin for the submental. Now I'm going to also do the superficial on both sides. Can't really see if they can see that well. And I'm going to also do the posterior on both sides. Can you turn your neck again? And posterior. And I'm going to keep you right there. I'm going to feel under for the deep. And then if you turn this way, feel under for the deep as well. Alright. So I got your lymph nodes done. And after I finish my assessment, I would go ahead and document all of my findings and report to my physician. Thank you.